871 in medic 6, you're seeing a 74-year-old male, shortness of breath.
On first contact with your patient, you will check their airway and assess their breathing. You know that without adequate oxygen, their condition will deteriorate and they will die. So, you establish and maintain the airway and provide supplemental oxygen if indicated. But how do you know if they are getting enough oxygen? How do you know if they are breathing adequately? We asked Joe Mistovich, chairperson and professor at Youngstown State University, to talk to us about the signs and symptoms of adequate and inadequate breathing, airway care, and ventilation techniques.
It's difficult sometimes to differentiate between adequate and inadequate breathing because it takes some assessment skill to determine how much volume your patient is actually breathing in and out. Again, you have to fall back on some of the basics, and the easiest way to determine whether your patient has adequate tidal volume, volume of air breathing in and out, is to look, listen, and feel. Look at the chest rise and fall. The chest should be rising with each ventilation. And also listen for air movement, feel for air movement at the nose and mouth.
Understanding the mechanical and physiological process of breathing will help you better assist your patients. Let's take a quick look at the respiratory system. The function of the respiratory system is to ventilate, to move air in and out of the lungs, and to oxygenate, taking oxygen from the air that we breathe in by moving it through our lungs into our blood. The blood then transports the oxygen through the circulatory system to our cells.
The difference between ventilation and oxygenation is that ventilation is an actual mechanical process. That's really dealing with the movement of air in and out of the lungs. Oxygenation is much more of a physiologic process, and that deals with the movement of oxygen from the alveoli into the capillary and the movement of carbon dioxide from the capillary into the alveoli.
These respiratory passages are responsible for gas exchange. The respiratory bronchioles turn into alveolar ducts. These form alveolar sacs that are made up of the alveoli. The alveoli in the lungs are where most of the exchange takes place. As red blood cells flow through the capillaries, the CO2 molecules are released into the alveoli and O2 molecules take their place in the blood cells. Maintaining appropriate levels of oxygen and carbon dioxide in the tissues is a critical function of the respiratory system. All the tissues in the body need a continuous and variable supply of oxygen to perform their metabolic activities. This is known as perfusion. Dead airspace is the air that is located within the nasal pharynx, the oral pharynx, and the larynx, the pharynx, the trachea, the bronchi, and bronchioles. This is air that is not used in gas exchange. The only air that is used in gas exchange is the air that reaches the alveoli. If your patient is not breathing adequately, then ventilation will help to force air through the dead airspace and allow oxygen to reach the alveoli. Remember, the rate, rhythm, quality, and depth of the respirations all need to be assessed. How can you tell if your patient is breathing adequately?
Fire department. Hi, sir. What seems to be the problem?
Can't breathe.
Okay, go ahead. Let's get a 15 liters O2, a non-rebreather mask.
Look at the patient's overall appearance. Are they straining to breathe? Are they sitting up and leaning forward? Do they appear anxious? Look at their nostrils. Are they opening wide during inhalation? Any of these signs can indicate difficulty breathing.
Well, we're here to help you. We're going to try to get
First,
you,
look or inspect the chest. Look for adequate expansion of the chest as it rises and falls. Look for a pulling inward or retraction of the chest muscles or the excessive use of neck muscles when your patient inhales. This is called accessory muscle use.
The signs and symptoms of inadequate breathing. Basically, you would find that the patient would have either a reduced tidal volume or inadequate respiratory rate. Now, the patient will exhibit other signs and symptoms associated with either a reduced tidal volume or an inadequate respiratory rate.
Okay, remember, this is oxygen to make you feel better.
One thing you'll find in patients is that hypoxia, or a low oxygen level, will cause patients to become anxious, aggressive, agitated, and hypercarbia, or high carbon dioxide levels in the blood, will actually cause your patient to become confused.
With your stethoscope, listen to one full inhalation and exhalation. Are the breath sounds present and equal? If an adequate volume of air is being inhaled, it will produce full breath sounds on both sides. If not, this may indicate inadequate breathing.
The patient who's breathing adequately has an adequate tidal volume and an adequate respiratory rate. Therefore, those patients, because they're moving an adequate volume of air into the alveoli, you can administer oxygen. The oxygen serves as a supplement to the air that's actually getting into the alveoli.
Common breathing assessment errors occur when EMTs assess only breathing rate or only the tidal volume. It is possible to have a normal respiration rate, but also have very slight chest movement with diminished breath sounds, indicating inadequate breathing. Inadequate chest movement can be caused by many things.
There are situations in which you may need to ventilate a patient who is spontaneously breathing, or a patient who still actually has a rate and volume of ventilation. These patients normally need to be ventilated because of either having an inadequate tidal volume or they don't have an adequate rate. Some patients would present with chest wall injuries, fractured ribs, in which it hurts too bad for these patients to breathe, so therefore they don't take deep enough breaths, in which you would actually have to supplement their breath with the ventilation.
Not all the signs and symptoms of inadequate breathing will be present at the same time. Don't wait for additional signs to appear. Assessment of one symptom is reason enough to start artificial ventilations.